Most doctors think that they have three options after they finish training: hospital employment, buying into a private practice, or entering academic medicine. There are other forms of practice that one can consider, and that might offer increased autonomy and happiness for both the physician and the patient. New forms of practice, such as cash-based care, in which a physician takes no insurance, thus removing pesky and time-consuming third-party payers, and only takes cash, is becoming increasingly popular. In the past, people thought this type of practice was only for the rich and wealthy patients. However, cash-based medicine's popularity is on the rise and seems to be producing remarkable results. Doctors are able to spend more time with patients and aren't restricted by government-dictated or hospital system mandates. Patients are also happier and feel like they're actually getting more time and support from their physicians. Dr. Attending, I'm really passionate about providing quality care for my patients in an affordable and accessible way, and also have an entrepreneurial spirit. I'm interested in cash-based medicine. What do you think? That is the most ridiculous thing I've heard all day. Docs aren't meant to be business experts. You need to follow my example, become a slave to a hospital system, and then flood yourself in tons of debt from extravagant living to numb yourself with the meaninglessness of it all. And then once you realize that the system is broken and unfixable, unleash all your anger and frustration out on your family and friends and then drink yourself to death. Even though cash-based docs don't take insurance, this method of practice is actually turning out to be affordable and more transparent than the muddled standard healthcare systems that send patients obscure, non-itemized bills so they can charge $200 for an aspirin, $50 for a piece of gauze, or $1,500 for a day using a hospital bed. It certainly doesn't look like a penthouse suite, so why should they be able to charge such insane amounts? A great example of a successful cash-based practice is the Surgery Center of Oklahoma. Pricing for various surgeries and treatments are posted online on their website and are not only transparent, but often cheaper than the same surgical procedures offered at surgical centers that accept insurance. If you want to learn more about cash-based practice, as well as other hot topics about the practice of medicine, I suggest that you check out the incredible podcast called Paradox, and also check out the Association of American Physicians and Surgeons, or the AAPS. The AAPS is an organization built to stand up for physicians, fight to preserve medical freedom, and patient-centered medical care. Based on my research, the AAPS actually speaks up for physicians rather than corporate or government interests, unlike other medical associations. The link to the podcast and the AAPS website is in the description box below for those who are interested. Another option for physicians who don't necessarily want to be locked into a job contract they don't necessarily like is to try working as a locum tenens doc for a while. So the perks of working as a locum tenens is that you're not tied into a contract, so if you don't like the job, then you can just leave. You also get to dictate how much or how little you want to work. Some locums positions actually offer a transition to a full-time position if the fit between the doc and the hospital is appropriate. So that's a good way to check out a system if you're not necessarily ready to commit. There are some downsides to being a locums doc, and these include the following: having to adapt to multiple medical systems that you're not familiar with, not feeling part of a medical community and not having stable work colleagues, traveling, which can be both a perk but can also get old, and having to pay for your own benefits. For those of you who are interested in learning more about working as a locum tenens doc, I've linked some resources in the description box below. This is NeuroGalMD, and thanks for watching. Subscribe to my channel for more incredible content, and as always, stay sassy. We'll catch you next time.